from West Virginia Public Broadcasting.
Support for the Legislature Today is provided by the following.
The West Virginia Higher Education Policy Commission, working with students and families to improve college access and student success for a better West Virginia.
Good evening, I'm Andrea Lanham at the Legislature Today. Tonight, the impact of the opioid crisis on a vulnerable group of children. But first, the Finance Committees have begun weeks of hearings where state agencies present their current budget situations. Almost every issue under the dome has a fiscal implication. Joining me tonight are two of the busiest legislators at the state capitol. We have Senate Majority Leader Ryan Ferns and House Finance Chairman Delegate Eric Nelson. Thank you, gentlemen, so much for joining me tonight.
Thanks for having us.
Great to be here. Thanks.
So how did we go from a projected $500 million hole 12 months ago to revenue running ahead of estimates today? What revenue stream specifically has turned around so significantly?
Well, so on the revenue side, we've had severance tax that both oil and gas and coal that have basically grown by 50% in 1 year's time frame. Also that we've had a big jump in personal income taxes because of increased employment from our prior year base. The other thing about that $500 million gap of last year, many of the policies and procedures that we put in place making very difficult decisions on the expense side are combined with the revenue increases, and so it tremendously narrowed that gap in a big way. So.
Did you have anything you wanted to add to that?
No, I think the chairman makes a great point. I mean, not just last year, but I think for the last several years, we've been looking at ways to reduce our spending and really hold the line when we were in a difficult budgetary time. A lot of folks were pushing and prodding the leadership in the legislature to raise taxes on, quite frankly, some of the poorest people in the entire country, and we just weren't willing to do that. But we were, as the chairman indicated, willing to make some tough decisions to reduce spending, hold the line, and wait for a better day, and we're finally getting to that point now.
So we have these 6-year projections from the Secretary of Revenue. How confident are you in those estimates that are 6 years out when we couldn't even predict 12 months ago that we'd be running ahead of estimates today?
I think that those 6-year plans are always a work in progress and constantly evolving, and we have an economy that's heavily reliant on the extraction industries, has been for quite some time. And commodities rise and fall. They have peaks and valleys. That's the natural course of action. If you look over history, that's common. And so it's not, just as many people did not predict the massive decline that we've seen in the coal industry in recent years, that many people did not accurately predict the slight rebound that we've been seeing, combined with, we're dealing with two extraction industries. We're looking at coal and gas primarily in our state, and so both of those have their own ups and downs and peaks and valleys. So I think it's difficult to predict, and I think it's probably historically something we've been dealing with for a long time.
Now, Delegate Nelson, last session the governor reached a budget proposal agreement with the Senate in the final hours of the session, but the House was left out of that conversation. Do any hard feelings exist as this session starts?
Absolutely not. Absolutely. I mean, many lessons were learned last year, and I think the biggest lesson may have been from our chief executive, who had only been on the job for less than 90 days, well, less than 6 months, in the same way with his cabinet. And now they have a full 12 months under their skin, and we're looking forward to all working together.
So you're anticipating better communication between House and Senate?
Oh, not anticipating. It's already occurred.
Yeah.
Ever since the end of last session, last June. So.
Yeah, I feel like, obviously the Republican leadership came in the majority, a little over 3 years ago. Of course, there's a learning curve for everybody, and I honestly feel like, from a communication standpoint, the communication between House, Senate, and the governor's office, as all three of those entities, is better than it has been since we've taken the leadership position. So I'm extremely optimistic about this upcoming session for that reason.
So the budget hearings are starting. These agencies have taken multiple cuts over the last several years. Were last year's cuts absorbed without too much carnage?
I think I think that would be an accurate assessment. I have not heard thus far in the budget hearings in the Finance Committee. I just came from the Finance Committee, and I'm filling in for Chairman Blair, who's still there. But we've not heard anywhere where we've made cuts where they've come back and explained to us the detriment that they felt from that. It's sort of been the status quo.
We're in the middle of these budget hearings, which will continue for another 30 days. And like the majority leader said, we've not had any negative pushback. And everybody's looked at this as some opportunities of becoming more efficient and providing better services to our citizens of the state.
Yeah, well said.
So who or what is hurting the most this year because of those cuts in terms of agencies and the populations that they serve? Do you know of any write-off?
No, I mean, really, and not to repeat the same answer, but thus far we just haven't seen or heard from any groups or agencies about any hardships that they've been encountering.
Now, the governor didn't mention cuts in his budget, but there are some, aren't there?
We're early in the process, and as we talk to some of those agencies, I'm sure that we'll hear certain areas that they're looking to become more efficient and prioritize their spends. But picking out one specific area, no.
We just spoke with the director of the West Virginia Center for the End of Life Care in Morgantown. They've been eliminated under the governor's budget. This is $150,000, which they estimate saves the state $45 million in unnecessary end-of-life medical costs. What's your view on that?
I actually just spoke to folks from the Center for End of Life Care this afternoon, and the report that I got from them was that their budget had been reduced by around 60%, but I wasn't aware that it had been completely eliminated. Obviously, when we're looking at the budget, there's a lot of little pools of money throughout the state. Did you say $150,000?
Yes.
Yeah, I mean, it's possible, but I was not aware that had been eliminated at this point.
Were you aware of that at all?
No, not to that detail. And again, with any line item or agency or group, we're there to listen. And again, it's about the prioritization of the spends and hitting as many people as we can for the state of West Virginia. So, but I've not heard those figures.
Gotcha. So the governor says no new taxes, so no new revenue streams either. What do you say about that?
Well, I think no new taxes. We looked at many things last session and really dug into a lot of different areas to try to make, I guess, the revenue side for our state is as good as possible to make us grow. What we're seeing right now is, our revenues in the state the prior 5 years were flat to down, and most of that was in our extraction industries. We had severance that was cut in half. But what we're seeing now is back onto our standard 2 to 3% growth on an annual basis. And that's what you see in our 6-year plan, is getting back on a regular growth basis. And then you put in place the road bond and all the additional revenue that's expected from that, the rebound in our energy sector, and there's many positives that we have to look forward to.
I think no new taxes as a message from the governor should be applauded, and something that I found very refreshing and encouraging, quite frankly. As I mentioned earlier, we have some of the poorest people in the country, and quite frankly, they can't afford to pay more taxes. It's incumbent upon us, in the legislature in particular, to best utilize every dollar that we have available, and we can't be so quick to just go to the taxpayers time after time if revenues are down. I don't think there's any misconception that there are opportunities for efficiencies in state government. And I think when we are in difficult budgetary times, it's incumbent upon us to maximize those efficiencies and look at it as an opportunity to do so.
Now, does the House and Senate approach the budget in the same way? I assume that there's some different philosophies between the two chambers.
Well, I think generally the process for the budget is approached in the same way. I mean, many of the hearings that the House has been having, we have been having in our Finance Committee as well. I don't know, this year if you guys are doing anything differently, but I think in general our approach is basically the same. And I think, as I mentioned earlier, that I know our Finance Chairman, Senator Blair, and Chairman Nelson have been having ongoing communication. Our vice chairs of those committees have been regularly going across the Capitol to the other side to meet, and so I think we're doing the best possible, the best we can to link up those two processes.
Absolutely. So we do have the agency meetings, but then both chambers have additional work groups that dig in even more with these agencies, which is nothing but a positive move. And this started last year when we were in our situations, and it will continue this year. The communication, it just improves all the time. And a lot of that just comes from experience. And we're both committed to having this budget done before our 60th day. I mean, we've agreed that by the 45th day, we'll have any bills with the fiscal impact of the budget out of both chambers. That is our goal right now.
Now, speaking about the agency hearings, the Supreme Court presented to the House last week and presented to the Senate today. Tell me a little bit about how that hearing went in the Senate today.
Well, actually, I just came downstairs from that hearing. As I mentioned earlier, our Finance Committee is still ongoing with other budget hearings, but the Supreme Court was the hearing that we just completed. I think there was a lot, obviously, based on what's been going on in the media, the reports that have been out there about the Supreme Court misspending. Chief Justice Lawfrey said that he recognized that it absolutely should never happen, that it was a tremendous misuse of government funds. So he wasn't backing away from any of that, but many of us had some questions about ongoing budgets and carryover dollars and things like that. I think we're still waiting to hear some complete answers on some of those questions. We've asked for additional reports and information based on questions that we asked that we didn't feel like were adequately answered. So I kind of think that hearing in particular may be one that's ongoing and may require several meetings.
You said that you'd requested additional reports. Can you mention what specific reports those were?
Well, one issue in particular, and this wasn't something that I went into the meeting planning to ask, but it came out in discussion. Chief Justice alluded to some of the carryover dollars being used for an e-filing system, and that is a system that he has said will create increased transparency amongst all the courts, amongst all the judiciary. But I wasn't able to get a clear picture of what the total anticipated cost of that program will be. The Supreme Court is carrying over about $8.5 million in surplus from the previous fiscal year, and so my first question was, what is that money going to be used for? Because they're only proposing a $2 million reduction for the current year. And so the answer was that would be used for the e-filing system. But what I couldn't get an answer on was what would be the total cost of the e-filing system if it's implemented statewide. Will it definitely be implemented statewide? What has been currently spent on it? It's currently in 7 counties. And so those were the kind of questions that I was trying to get answers for that I wasn't able to get a clear answer.
Switching gears a little bit, everything has a fiscal note. Let's talk about other additional spending. Addressing the opioid crisis is going to take new money. Where do you see that appropriation coming from?
Well, DHHR is one of our agencies that we'll have in, and I believe it's in the House next week. Most of the savings that are inherent in this year's budget are coming from efficiency and policy changes at DHHR. And hopefully we will redeploy those to areas of need, and especially our drug situation right now, that we're just hearing time and time again that's a very big hindrance on companies and employment.
Yeah, I know when we spoke with Department of Revenue, they talked about a lot of carryover money within DHHR. A lot of that came from Medicaid surpluses. The Medicaid aspect of DHHR apparently, is extremely conservative in their their estimations for the amount of dollars that they'll need. And so we're talking about tens of millions of dollars that were carryover surplus. So I think that's a possible source of revenue for that treatment.
One of our downsides, especially with new revenue at DHHR, is what's called the FMAP, the federal match on the Medicaid and Medicare. And I believe that increased by about 1% last year. So one of the downsides of our economy going down is a benefit on federal reimbursements that come to the state and in essence require fewer state dollars.
And speaking about the DHHR, there's a bill moving through right now that would divide the DHHR into 4 separate entities. What kind of effect is that going to have on the budget?
Well, I think that's something that in the course of considering that legislation, we'll have to, those are questions that we're going to have to answer. I think the Health Committee in the House and the Senate worked together quite a bit in drafting that legislation. Many of us have been hearing for years that DHHR is not efficient because it is so large and includes so many different agencies within DHHR. I know that questions and concerns have been raised about if we break up that, does it decrease the amount of federal funds that we're able to pull down? And that's what we have to figure out, quite frankly. Is there a way to make those entities run more efficiently without losing any federal dollars?
Now, community and technical college scholarships, that came up yesterday in the Senate. What do you see happening with that?
Well, that's obviously, our Senate President that's been one of his major initiatives and something that's, been a real focal point of his personal legislative agenda, for the upcoming session. I think that the Senate is absolutely prepared, to move forward on that. But, even within the Senate, there are concerns about the way that it's implemented. And I think that the House probably shares those same concerns. We don't want this just to be a giveaway. We're looking at making sure that any student, new or older, would seek out any federal funds, grant funding, anything like that prior to applying for these dollars. We've even talked about a work requirement, so making sure that the state of West Virginia and the taxpayers of West Virginia get a return on that investment. But ultimately, the reason the Senate President is so eager to go down this path is one of the biggest complaints from job creators and employers in our state, or those considering operation in our state, is that we don't have an adequately trained workforce. So it gets right to the root of that problem. I think sends a great message to the rest of the nation that West Virginia workers are going to be prepared for the job.
And we had the community and tech, we had both chancellors in House Finance yesterday. And what was interesting when Chancellor, Community and Technical College spoke, we have 26,000 students in our Community and Technical College system. The average age is 29. And when we start talking about the future of West Virginia and the training that's necessary for Procter & Gamble and up in the northern panhandle in the oil and gas and chemical, I think we're both tremendously dedicated to putting the resources back to our community and technical schools.
Well, thank you, gentlemen, so much for being here. There's obviously so much to talk about, and this is going to be something that we follow as the session goes on.
Thanks for having us.
Yeah, thank you for having us.
Now we switch gears to focus on just one group profoundly impacted by the opioid crisis. Throughout West Virginia, thousands of children are in foster care, and opioid abuse is sending thousands more to join them. In the State of the State address, Governor Jim Justice called for additional funding to help the system deal with the explosion of numbers. Liz McCormick brings us the story of a family in the Eastern Panhandle.
Stay-at-home mom and daycare provider Jen Holden lives in Kearneysville, Jefferson County with her 6 kids. They're like any other family. They joke with each other, share meals, laugh, play, and watch movies together. They love church, and they're actively involved at school and within the community. But Jen is also a former foster parent who, for 14 years, along with her ex-husband, fostered 27 children ranging in age from infant to 18.
I had heard adoption stories, and I really started to think I would like to adopt. And when I started to research, I really didn't know much about the foster care system at all, but when I would type in adoption, foster care would come up. And I educated myself, and I thought, that's what I want to do. I want to help children.
Jen also has 2 biological sons who are in high school. Of the 27 children she's fostered, she adopted 4, 3 of whom were exposed to drugs or alcohol in utero.
My youngest was born addicted to 3 different drugs, and he was in the hospital for 3 weeks. When he came home from the hospital, he screamed for 4 months straight until he really got off the drugs. Right now, he's on target. He's really excelling and doing really well.
The 2 other children impacted by drugs or alcohol are biologically related sisters. The 9-year-old was born while her mother was addicted to heroin. Jen says she's doing well, but will likely need ongoing help in school. Jen's other daughter, who's 11 years old, struggles a bit more.
She's probably on a 2nd or 3rd grade level and should be in the 6th grade. And she has fetal alcohol syndrome. She suffers from epilepsy from the fetal alcohol syndrome and is severely delayed.
Both girls also have attention deficit hyperactivity disorder, or ADHD, and take medication for it. Jen says despite medical and academic struggles, she loves being a mom and watching her kids grow. But there are other kids in the foster care system, thousands in fact, who still need help. For Jen, the solution is making sure these kids are placed in a secure environment early and for the long term.
We just need to get these kids in permanent homes as fast as we can so that they can just heal. I mean, if they're drug addicted, then they need to overcome that. If they've been taken away because of neglect and abuse, then we need to get therapy and let them do that. But they can't do it while they're jumping from placement to placement or going home and coming back. And I think we just really need to put the kids first.
But finding permanent homes is rarely easy. The West Virginia Children's Home Society, or CHS, is one of 10 agencies in the state that handle foster care referrals from the West Virginia Department of Health and Human Resources. The organization works to find the best matchups for children who need temporary or permanent placements, whether that's in traditional foster homes like Jen's or in other placements, such as with a relative or in emergency shelters. Chief Executive Officer of CHS, Steve Tuck, notes that in just the last few years, there's been a dramatic spike in the number of children coming into care. This has made it harder to ensure these kids find adequate home environments. He says the opioid epidemic has played a major role in that rise.
The need has only gone up. The number in care had gone up close to 6,000 from what it had stabilized for many years at around 4,000 state kids in care. It's even in these last few months, it's gone up almost 100 a month.
DHHR reported in November that nearly 6,400 West Virginia children are in foster care. That's about 1,000 more kids in care than November 2016. Tuck says it's hard to pinpoint just how many of those children are coming into care as a direct result of substance abuse. For example, if a child is pulled from a home because of some form of neglect, the role substance abuse played isn't always clearly noted. Likewise, when children are born with drug-related issues, there's no consistent methods for determining the extent of parental substance abuse. Tuck says to improve these situations, there needs to be more communication.
We all need to get together from the medical, especially the hospitals that are serving those situations, and the ones that might need to take custody for children.
Despite the difficulties, Tuck argues the general consensus regarding the number of children coming into care due to substance abuse is at least 50%.
And I've seen numbers as high as 90%. But that's really probably people's more anecdotal, who've worked in this work a long time, acknowledgement that it almost affects every placement of children coming into care.
Tuck says one way to help limit the number of children needing to enter care is to start with the families. CHS, Marshall University, DHHR, and the Behavioral Health and Addiction Treatment Center, Prestera, which serves several West Virginia counties, are all working together on a pilot project to help addicted mothers get the care and therapy they need to get off drugs and keep their children. The pilot project has been launched in Cabell, Lincoln, and Wayne counties first, but Tuck hopes if it's successful, it will expand to all 55 counties. Tuck asks state lawmakers to keep the foster care system in mind this session.
My encouragement to them is really just to acknowledge that there's a lot higher cost to taking care of these kids, and there are West Virginia children that we all are responsible for. So they really have to look at that when most of the discussions are around budget cuts and reduced funding and things like that.
Back at the Holbens, Jen encourages more West Virginia families to think about becoming foster parents.
You hear all this stuff and it can scare you away, but it is the most rewarding. Every kid I've had has been a blessing to me. But definitely educate yourself so you're prepared for what you might deal with. And just always remember that a kid that comes to your house through foster care, through adoption, through anything, their story goes beyond the day you bring them home. And whether you bring them home as a baby, they still have biological parents that it's part of them and it's part of their story. Their story isn't just being in your home.
Still, Jen's biggest concern is ensuring the children who end up in West Virginia's foster care system are placed in permanent homes as soon as possible. For the Legislature Today, I'm Liz McCormick in Jefferson County.
Tomorrow night, we'll take an in-depth look at the opioid epidemic in West Virginia. Reporter Jessica Lilly travels to Mingo County to talk to residents about the drug abuse impact on the town of Kermit. We'll also be joined by 2 lawmakers, both doctors and both working on legislation to address the opioid crisis. That's tomorrow night on the Legislature Today. As we wrap up this evening, remember you can watch your lawmakers live here on West Virginia Public Broadcasting. Coverage of tomorrow's floor sessions from both the House and Senate is scheduled to begin at 11 o'clock in the morning on the West Virginia channel. For the Legislature Today, I'm Andrea Lanham. Thanks for watching and have a good night.